My prediction for the outcome of this year's health care reform debate is that the bill will be called the Kennedy-Dingell bill. I'm hoping it will look a lot like the Healthy Americans Act. We don't know yet. But when all is said and done, when all the speeches have been made, when all the deals have been cut, and the last cab has died, successful legislation will require 60 votes in the U.S. Senate. Now, it's technically possible to get by with 51 and to use the reconciliation process, but I don't think that's going to happen. When Secretary-designate Tom Daschle testified before the Senate, he said that health care reform should pass with 70 or 80 votes. Governor Sebelius has said virtually the same thing. Unfortunately today, to many people in Washington, however, the word bipartisan is not a compliment. It's a slur. It means that you did not negotiate hard enough with the other party. Wyden-Bennett achieves universal coverage, a longtime Democratic goal, by using market forces, a cherished Republican technique. That's why it's bipartisan. And this isn't bipartisan in the token sense of having 2 liberal senators from Maine on board. This is bipartisan in the sense of having Lindsey Graham on board, Joe Reddick, Bob Bennett, Mike Crapo, what many Republicans in the Senate would call real Republicans, including our own Lamar Alexander, third in Republican leadership in the Senate. So do me a favor, congratulate Lamar when you see him, because he's sticking his neck out on this. I think this bipartisanship is fulfillment of President Obama's call for post-partisan politics in Washington. Wyden-Bennett, the Healthy Americans Act, allows everyone to shop for health insurance the same way that federal employees have been doing it for 30 or 40 years. We've been the guinea pigs. Now it's time to share that perk with the public, because it works, and it works so well. We have annual menus of private health insurance options so that you can pick which plan best suits the needs of you and your family. And it's based on an extremely broad risk pool with hundreds of thousands, millions of people in it, not segmented by small business. Everyone would get the same benefits that Congress gets. In my case, I get Tennessee Blue Cross. No substandard insurance on the menu. Everything actuarially equivalent. No free lunch. It's paid for. Scored by not only the Congressional Budget Office, but by Peter Orszag himself, who's now the head of the Office of Management and Budget. So it's an opportunity to save money, which is particularly important in tough economic times. I think an indispensable part of health reform is allowing the employer-based system that we've had since World War II to be gradually, let me emphasize, gradually replaced by larger, more reliable risk pools that have to take all comers, that have to take everyone, regardless of age, regardless of sickness, regardless of disability, regardless of injury. I don't call this big government, but a way for private health insurance companies to compete, not to drop us from coverage, but to serve our healthcare needs. One sticking point, at least with the Wyden-Bennett plan, would be President Obama's campaign criticism that John McCain's plan would, quote, tax your healthcare benefits. If you understand today's tax breaks for health insurance, I think you will see that we can rearrange these tax breaks without cutting them. Because today's beneficiaries of our current tax break system are the highest paid employees of the largest companies. Why are they deserving of the biggest tax breaks? They're actually the folks who need it the least. Why don't we distribute the current tax break more fairly so that every family gets, say, the equivalent of about $15,000 so that they can afford family coverage for them and their family? Is that big government? Is that controversial? Another sticking point is whether a public option should be included in the plan. If you read today's New York Times, you'll see a relatively superficial discussion of the issue. And while it's theoretically possible to include a public option on this menu of choices, you can theoretically construct a level playing field so that private health insurance companies will still want to compete against what they will perceive as the 800-pound gorilla. While you can do that, and while you can get through the extra few hundred pages of complexity that would introduce, it does two things that are critically important politically. Number one, it'll probably scare off every Republican from the bill. So you'll no longer have bipartisan legislation. And that's not necessarily a deal killer. But the other one is this. You would ruin your pitch of sharing the federal employees' health benefit system with the public, because we've never had a public option. We can't guarantee to people that it will work with the public option. So we haven't been the guinea pigs anymore. We would make you the guinea pigs. And while Medicare and other options like the VA have many, many, many pluses, Medicare alone, as I mentioned earlier, is $34 trillion in the hole. So I'm hoping that Congress will not only vote on comprehensive health care reform this year, but if we're sensible about it, do it before global warming, we'll do it by this June. It's essential that we act before the honeymoon period is over, and foreign powers, terrorists, and others have a distressing amount of control over the honeymoon period. I think that it's very important that we acknowledge how difficult this will be, even if there were to be broader consensus, as I think there can be, on a health reform plan, so that President Obama would not have to spend all of his political capital on this. And the resistance will come not only from across the country, but from communities like in Nashville, because we are a healthcare capital. And the most fundamental equation in all of healthcare is the simple truism that the $2.4 trillion that we're currently spending on healthcare exactly and precisely equals what? $2.4 trillion of vested interests, none of which want to give up a penny, none of which will admit that they're wasting taxpayer money, even though the evidence, whether it's Shannon Brownlee's overtreated, whether it's the McKinsey data, whether it's the Dartmouth data, indicate that $700 billion a year are in fact wasted, or almost 1/3 of the total. Peter Orszag, the head of OMB, has testified to this number in congressional testimony.